Okay, good afternoon. I'm Mayor Paul Elward with the Beetle County COVID-19 Unified Task Force. Before we move into our discussion topics, I would like to start with a brief statement and an update from the task force. The current update from the South Dakota Department of Health shows 222 positive COVID-19 cases in Beetle County with 3 deaths. Beetle County now has 68 individuals who have recovered from COVID-19. There are 4,866 active cases statewide with 3,744 recovered. The Beetle County COVID-19 United Task Force has reached a critical point, and the incident commanders would like to emphasize the importance of strong social distancing and protecting yourself and your family. Since March 15th, Beetle County has seen an explosion of COVID-19 positive cases. Beetle County has seen a recent death, and COVID-19 is affecting everyone. It has not discriminated and is affecting young and old, along with not picking a certain race. Everyone is susceptible. The Beetle County COVID-19 testing facility here in Huron is averaging a 75% infection rate of those being tested. This does not include the numbers being completed with private healthcare facilities. Everyone may be thinking more people are being tested because changes at the state level. Yes, the state is testing more people, but the reason for Beetle County is testing more individuals is due to people having contracted with positive COVID-19 individuals, and they've met the testing criteria. Due to the contact tracing, Beetle County is at a critical point. The goal of the Beetle County COVID-19 Task Force is to slow the spread of COVID-19 and allow for enough bed space in our medical facilities. If we continue to increase positive numbers and hospitalizations continue to grow, there may not be room to care for everyone in our community. Those are critical decisions that no one should be made to make. Do you want to be the person whose family member is struggling with COVID-19 and they are in a completely different community? It is time to act. We need to protect yourselves, protect your business, and protect our health care facility. For individuals who elect to travel outside of their homes, it is highly encouraged that you wear a mask. If you are in a high-risk category or have a comprised immune system, you should consider having someone else get the necessities that you need, and or take advantage of some of the pickup programs we have here in our city. We are still encouraging to minimize trips outside of the home. Only one household member in a store at a time would sure help to reduce the numbers in our stores. Non-essential travel, maintain social distancing. If you do not accept the responsibility to mitigate the threat of COVID-19, our infection rate is going to continue to climb. If you have been notified that you have been in contact with a positive COVID-19 patient, you need to be immediately self-quarantined and to monitor the COVID-19 symptoms. This is not the time to be going to the store, visiting with your friends, or running errands. As soon as you get notification, this means that you go directly to self-quarantine. If you need assistance with supplies, you are able to contact the Beadle County COVID-19 call center at 605-353-6214. You should have a plan in place for your home on how you're going to keep your household members separated. Now more than any other time, it is very important to start keeping track where you have been and the people that you have been in contact with. You have also able to download a COVID-19 app that will assist you in that. For businesses, your elected leaders have loosened up the restrictions that were originally placed in the ordinance in March. This is a call for action for all businesses, large and small, essential or not. You have been provided guidelines, and it's time to start following the guidelines to slow this spread that we are seeing of COVID-19 in our community. We have the responsibility to slow this down and take the steps to protect our staff, our customers, and whether you are installing barriers, one-way aisles, removing items to make sure that there's 6-foot distancing, or limiting customers who enter your store at a time. These are new times, and we need to come up with new routines. We cannot expect to keep COVID-19 at a manageable level if we are shoulder to shoulder in these places. People are dying every day, including members of our own community. We cannot make COVID-19 go away, but we can take strong stances to slow the spread. And now is the time to do so. I want to thank you very much, and now we'll move on to our presenters today. And to start with, we'd like to have David McGurr, President and CEO of the Greater Huron Development Corporation. He's been working on some guidelines for businesses. And David, if you'll explain some of that to us, we sure appreciate it.
Thank you, Mayor. Yes, Greater Huron, in partnership with the Chamber, has been working on a back to business playbook for the city of Huron. And you'll see it on your screen there now. This is a comprehensive guide for best practices for all kinds of different businesses. It's not, there's general guidelines that apply to every business. But if you look on page 3 of the document, there's specific in the index pages for hair salons, nail salons, gaming, bowling alleys, movie theaters, exercise, hotels, manufacturing, office professionals, pharmacies, real estate. It covers the whole gamut of businesses with specific advice for each of those businesses. And it also talks about employee and customer protection in this booklet, and how to keep the workplace safe, the best ways to communicate with your team, and deep cleaning and when you need to do it, and the process that you should use. Cleaning, disinfecting. There's a whole, when masks are appropriate, when face shields are appropriate. Very comprehensive guide that we've been working on, and it even tells you how to make your own mask in this booklet. So we encourage you to download this booklet. It's here's the sections that for different child care facilities, salons, nail salons, construction. And say it covers all of them. And then the Department of Health recommendations are towards the back. Each of these businesses also has references to national organizations that have guidelines specific, for instance, to a barber shop or to a real estate agency. So there's just lots and lots of guidance in here that can keep you and your staff and the public safe. We encourage you to take a look at that document, and it can be found on the Greater Huron website. So if you go to greaterhuron.com and then choose the COVID-19 tab, when you scroll down, we have our resource toolkit. So click on the business toolkit, And right here is the playbook, a little description of it, and you can click it right here and download the booklet. We also have hard copies available at the chamber office. You would prefer to have a hard copy rather than the digital version. So again, that's a free booklet, and please take advantage of it as much as you can. Regarding today's cases, we have been graphing the cases ever since this started back in early March, with our first positive case verified on the 9th of March. And we also have been tracking where deaths are occurring. Around the 1st of April, we had 2 deaths, and then we went 41 days without a case. We had 1 case on May 12th, and we went a few days without cases, and now we're experiencing a spike unlike anything that we've seen before. This increase is doubling in quantity every 5 days, which is the same trajectory that New York City experienced when they had their big ramp up of cases. So while it's a different scale than New York City, per capita, the outcome is the same. If we can't flatten this curve off, we would expect statistically to see 80% of our population get the virus, which is not what we want, because that will be unnecessary hospitalizations, unnecessary deaths, and it will be a lot of pain and suffering. So along those lines, we want to educate the public about the importance of that. This is here. We got a little lackadaisical on it during the 40 days when we had no cases and everybody got quarantine fever, including myself. But we need to be sure and start doing what we have to do. So we are launching a new campaign. There will be yard signs and posters and social media posts. We just put this together in the last 24 hours in response to this spike. And this is the yard signs that you will see around town. Only you can keep Huron open. And the point of that is if we can flatten this curve and flatten it very soon, the hospital will be overrun and the city will have to be shut down. Not just restaurants and bars and gyms as before, but we will have to close all businesses like they did in New York City and other serious hotspots. Nobody wants that to happen. The businesses don't want it. The citizens don't want it. They want to be able to go out to their businesses. And certainly city and elected officials and the task force don't want it to happen. So it's time to buckle down. We are Huron. We did it before. We beat a spike before, and we dropped our social distancing by 80% last time. But then it's just crept upwards since then, and now we're in the danger level. So we can do it again. We're stronger together, and I encourage everybody to please wear a mask anytime you're around somebody. Employees and employers should all wear masks when they're around their customers or within 10 feet of each other at work. And don't be upset if a business asks you to wear a mask. They are trying to protect their staff and the public, both, by not getting their staff sick or infecting anybody else. People that get COVID, on average, spread it to 5.6 other people. It's 10 times more infectious than the flu. And of course, the effects of it are much more serious than the flu. And we don't want to see people getting sick or dying from something that could be avoided. Each person needs to make a decision to not get the virus and then act accordingly. It isn't inevitable. If you take precautions, wear a mask, don't go out when it's not necessary, and keep your social distancing, you can make a decision not to get the virus, and most likely that goal will be met. And that way, you're upholding your personal responsibility to not spread the virus to 5 or 6 other people. Even if you're asymptomatic and you don't have any symptoms from it, you still could make another person sick who could end up seriously ill or could die. And you don't want that on your back. And so please take this seriously. Thank you.
Okay, thank you very much, David. I just want to remind everybody listening, if you have questions about any of this, you can give us a call or send us a message. Next with us, we're very pleased to have Julie Hoffman with us. She is a Huron business owner, and she would like to tell us a little bit about what she's doing to help stop the spread of COVID-19. Julie, welcome.
Thank you, Mayor Elward. We just wanted to come on, and David asked us this past week if we'd come on and share a little bit about what we're doing in our business, as you said, to keep people safe, some of the things that we've done. Just a little backstory. This is our 37th year in business. The 37th spring that we've been open. And I can't imagine back then when we first started our business, we could ever imagine that we would have to deal with something like this. We thought that it was hard enough finding good employees and doing all the things we need to do to run a business. But this situation that has come up is something like we've never seen before. And as many small business owners, we tend to, when we first tackled this as far as what we were going to do in our stores, it was overwhelming. It took us a good month to figure out what we were going to do. And I so appreciate David with the playbook that they've come out with now. I think a lot of people are looking for guidance, are looking to figure out how we are going to keep our employees safe and how we're going to keep our customers safe. So, when this first all started, we were closed for 5 weeks, and we just did the curbside service. And I know a lot of businesses have chosen to continue the curbside because they're not quite comfortable with opening yet. And I would encourage people as businesses start to reopen or whatever measures they're putting in place, that people respect that we help each other, we hold each other up. If, as David said, someone asks you to wear a mask, you do so willingly. And if that is really, and there's so much opposition on both sides, that there's people that feel like we should be all wearing masks, and then there's the other side that, that people feel like their individual freedoms are being stepped upon. And I understand that we need to come together. We need to respect each other's opinions, and hopefully we can work this all out. So some of the things that we're doing at our own store here, and some of them in the last, as I said to Landon this morning at the chamber, a few weeks ago, quite frankly, I was almost ready to close the store. We had been open. We opened up the last Monday of April for walk-in customers with our rules, and we were getting some comments that, quite frankly, weren't so nice from people. And I know, I feel the frustration. I feel, as a business owner, I feel the frustration of people being quarantined and the quarantine fever, as Dave referred to. And I'm hopefully giving them a little grace, the people that were upset with us, that we are all trying our best trying to do this. So having said that, here's what we have in place right now. We are on our regular store hours, Monday through Saturday, 8:30 to 6. We have not gone to our extended spring hours. Usually in the spring we stay later open in the evening. Those last 2 hours of the evening from 6 to 8, we concentrate on cleaning the store, cleaning all the areas that people have been in during the day. We're sterilizing door handles, doorknobs. We're wiping down all the counters. We're bleaching our carts out that people use in the greenhouses and things. So and that takes us almost 2 hours every evening to do all that cleaning. When people are coming in, we also have posted, we have a large poster on our wagon out front of the store with some of our rules listed. And as Mayor said, we're asking, if we are extremely busy, as we were on Mother's Day weekend, that only one person per vehicle or family be shopping at a time, to limit that spacing, to make sure that people are keeping their distance. We do have one-way signs in our greenhouses down the aisles. They're rather narrow, so we're asking that people, again, if we're busy, that people please use those one-way signs to help keep the distancing going and keep things moving slowly. If we are not busy, 1 or 2 cars in the parking lot, we're letting people shop together. You come with a friend or your husband or a family member. We're allowing that to have more than one person. But again, we're just really asking people to use their judgment. If we've got a really crowded Saturday parking lot, that you do limit the number of people that are coming in. The next item that is on our list of rules, and this is probably the one that's given us the most anxiety, is that we are currently not allowing children under 16 to be shopping anywhere on our property, anywhere in the store. That includes outdoors, in the greenhouses. We feel very strongly about protecting our children, and it's not that people that we don't love children. We are truly missing our field trips. We had the Madison school scheduled, about 150 kids that were supposed to come out and plant and tour the greenhouse this spring and May. That, of course, we had to cancel, and a number of other schools and preschools that were going to bring children to help to learn about plants. So our hearts are hurting for that. We are really, truly missing that. But for right now, because of the current situation, we're asking that you not bring your children along shopping. Our little theme here at the store is shopping with a purpose. It really helps to have a list, to know kind of the things that you're looking for. And we realize with our business, with the flowers and the plants and the trees, a lot of it is inspiration. You're looking and shopping, and we've normally had that happening here. And we encourage that, but we also encourage people to shop with a purpose, have a list. You know, if there's a few things you need to look at, great, that's fine, no problem. We are not requiring or asking you to wear a mask outdoors. It's difficult even for our own employees outdoors when the heat comes on, as we had that really warm day this last week, to wear a mask all the time, especially in our greenhouses. So we're not requiring that, but asking you to do the social distancing out there, the 6 foot apart, being respectful of other people's space. But when we do come, or when you come in to check out inside our main store, we're asking that you do put on a mask. And again, this has been a sore point with some of our customers, and we understand that you do not want to wear a mask. If that is the case, we can have you stand outside, and we can take your payment inside the store and check you out. So that is one thing we're doing. Another thing, too, is we have hand sanitizers at all the doors. We're asking that you sanitize your hands before you come in. Even if you are wearing gloves, we're asking you to sanitize your hands so that we're not spreading anything around inside the store. It would be very difficult for us, if you've been to our store, as any retail store, to clean every item in the store every night. So these are just a few things that we're asking people to do. You know, we're certainly open to suggestions to make it safer for people, for our employees. When we discussed all of these rules, we took into consideration, we have employees, actually I have 2 women that are pregnant that are working here. And I have other people and that may have a few things that they might be compromised if they were to catch COVID. So we are very serious about the rules, about working with people. We do have our online ordering service. That's another big plus for people who absolutely don't want to come in the store. You can order online, go to our website, and then we can have you pay over the phone with your credit card. We can set it out curbside. You can drive in and it all be contactless. So you don't have to be in contact with anyone, which has worked very well for a lot of our customers this spring. I just wanted to say, too, that we are taking this very seriously. My own daughter is a physician assistant at Mayo in Rochester in the ICU at St. Mary's. And the medical people that we know, that we have relatives and things, are very serious about this, and they have encouraged us to be serious about it too. So if anyone has any questions, if you're running a business, I kind of liken this, if you watched the Super Bowl a few years ago, there was a commercial on there about herding cats. Does everybody remember that? About not being able to get them all to go in one direction? And this is what I feel like as a business person. We're herding cats. Our customers are all different. They're all very unique, and we love them all, but it is a difficult time. So if there's any business owner or person that has a suggestion that could help to make our business better, I would love to hear it. Too, if anyone would like to talk to me or someone here about what we're doing, I would certainly do that too. So please, as David said, the new program about only you can keep Huron open. If we all work together, we can make this happen. Thank you.
Thank you very much, Julie. I appreciate you coming on this afternoon, and we appreciate your efforts with your business. Next on our program this afternoon is one of the representative of some of the people that are the first responders and some of the first people who may encounter the positive COVID people in our communities. Ron Hines is the chief of our Huron Fire Department and also works with the ambulance service. And he wants to tell you a little bit about what they're encountering out there. Ron, thanks for coming today.
Yes, thank you, Mayor. First, I'll start off on behalf of all the Beadle County first responders. We'd like to give a shout out, a thank you to Beadle County. You guys everybody in the county has been very supportive of our first responders, fire, EMS, law. We're all in this together. We're trying to slow the spread and get this virus, somewhat under control. Some of the things that we have been encountering out when we go to our calls is our social distancing. We've had several instances where we've had people that are really not abiding by our social distancing. We're concerned about not so much our community spread, but family spread. If you have a person in your home that is positive, or yourself is positive, we're asking to look at that, try to figure out how to quarantine yourself, stay safe, and keep your family members safe. We've seen our increase in our numbers in Beadle County. The virus never went away. We held at 21, 22 for a long time. We still had the virus in our community, and we did a really good job of keeping that in check. We're seeing our increase. If it's because of the nicer weather, if it's because of travel, that's the Department of Health is doing their tracing on that. But we're starting to see an increase in calls for service on the EMS side and fire side for COVID positive patients. So we're asking the community as a whole. We have done such a great job at the beginning of this to watch what we were doing, practicing our hygiene, wearing our mask, utilizing our curbside services, our call-in services. We need to stay vigilant on that so that we can kind of, get this virus in check. We knew we were going to see an increase. That was predicted. We knew that we were going to start to see a spike. If we can get this could be our tipping point where we could get this flatlined, peaked out, and go back to somewhat of our normal everyday lives. But we need to, you hear this all the time, the new normal. We need as a community to just kind of take a step back, watch what you're doing, keep yourself in a safe distancing from people, the masks, the hand sanitizer, the washing the hands, the social distancing, all those have been put out by the CDC. And as a community, it's our responsibility to kind of follow them. They're out there, they're guidelines. If you don't want to follow them, that's your prerogative. But as a medical person, as a first responder out there, we're asking the community to just keep an eye on things. Maybe we got a little too lax. I'm not an expert on that. I never have claimed to be an expert, but we've seen our increases in numbers. We just need to start. Our initial thing was to stop the spread and flatten the curve, and we did a really good job of that. We've got a spike. Now, we need to get a rein in on it and just sort of stop that spread again and see if we can flatline it and stop that curve from going up. If you look Greater Huron has done a great job with their charts, but our charts are getting up there. With Julie and our local businesses, they've done a great job in providing, the social distancing in our businesses. Some have opened, some have stuck with curbside. And David's got Greater Huron has their playbook. Those are resources that has been put out there for the community to stay safe. We're just trying to limit our exposure on the first responder side, and so that we can keep our family members safe and keep our community safe.
Thank you, Ron, and I want to thank all the first responders in the county, all of those, and also our police and our dispatchers, our sheriff's department here in Beetle County. All of these people are ones that may encounter more COVID than any of the rest of us. So be careful out there, and thank you for your service there. The next thing we have on our program this afternoon is a statement from the Huron Regional Medical Center. They were not here to be able to be here in person, but I do have a message from them that I'd like to relay to you. As of this morning at 10 a.m., there were 3 COVID-19 inpatients at HRMC. Physicians and staff will continue to monitor the increased positive test results. HRMC is currently operating at a surge level 2. This means that there are 2 to 5 positive or suspected positive COVID-19 patients. Surge 3 is defined as 5 to 10 positive or suspected positive COVID-19 inpatients. As more community members test positive, HRMC wants to emphasize that the importance of personal responsibility in protecting yourself, your family, and others. The basics are still the best protection. Wash your hands often. Soap and water is the best. Wear a face covering when you go out. Maintain a 6-foot distance between you and others. Sanitize high-touch surfaces often. And maybe the most important, stay home if you can. If you have been exposed or experienced symptoms, you need to call your provider, or you can also call the call center here in Huron at 353-6214. You will be guided on testing, treatment, and quarantine recommendations from the call center. If you've been diagnosed and are caring for yourself at home, it's important to have a support person who can check on you regularly. If the symptoms are worsening and/or you have difficulty breathing, you need to seek emergency treatment immediately by calling 911 or coming to the emergency room at the hospital and calling them when you are on your way so that staff can be prepared to help in the best way possible. And I want to thank HRMC for this advice, and also thank them for the care that they give our community, all of Beetle County. And we need everyone here in the county to take on this challenge to stop the curb and support all of your businesses here when you can. But the main thing we need to do is make sure that we stop the surge so that our hospital can effectively treat all the people that are sick. We've done this, as Ron said, we've done this before. We can do it again. And I know the people of Beetle County will accept this challenge and work very hard to stop the spread of this terrible COVID-19 virus. So thank you everyone for listening. Do we have any questions? Okay, we don't have any now, but if you do have some you thought of later, you're welcome to send them to this address, or you can call City Hall or contact your local first responders, or the hotline is a good place to call with questions. So if that's all we have this afternoon, I want to thank everybody for listening, and we'll see you next week at the same time. Thanks, everyone.